Thank you, Chairman Graham and members of the Senate Judiciary. The most vulnerable people group in the United States are unborn children in the womb. I'm Dr. Donna Harrison, a board-certified obstetrician and gynecologist, and the executive director of the American Association of Pro-Life Obstetricians and Gynecologists. I submit this testimony on behalf of our membership of over 4,000 reproductive health medical professionals across the United States. There are small human beings in the womb who are being pulled apart in pieces or having their skin burned off or partially delivered through their mother's vagina and having their brains pierced and sucked out through a suction catheter. The Pain-Capable Unborn Child Protection Act will protect unborn children in the United States from being killed in these brutal ways. Many of the children being protected are children old enough to survive outside their mother's womb. The fact that unborn children who are 20 weeks or older can live outside the womb underlines the fact that these tiny human beings are separate individuals, and we as a nation have both a right and a duty to protect our most vulnerable members from being hurt or killed. It is scientific fact that 20-week babies are very sensitive to pain. They react the same way that you do. They withdraw from painful stimuli. They release stress hormones. Their heart rate increases and their breathing increases. These are measurable changes under pain. The structures which transmit painful stimuli from the skin to the brain are present very early in fetal life. And anesthesiologists for the last decade have used fetal anesthesia as standard of care for in utero fetal surgery. When an unborn human being has to undergo surgery in the womb, the anesthesiologist gives that tiny human being separate anesthesia. Why? Because the anesthesia given to the mother is not sufficient for pain relief in the fetus. It is standard of medical care to give the fetus separate anesthesia when surgery is performed, and it is pure pro-abortion fantasy to claim that pain relief given to the mother causes the fetus not to feel pain. Fetuses feel pain just like you do, and their body reacts to pain just like you do. Appendix A of my testimony is Apolog Practice Bulletin 2, Fetal Pain, which is a summary of the scientific literature on fetal pain up to 2018. Appendix B is the testimony of embryologist Dr. Maureen Kondik before the U.S. Judiciary Committee regarding the capacity of unborn human beings to feel pain. Does an abortion in the second and third trimester cause fetal pain? The answer to this question is obvious when you look at the reality of what is done to these unborn human beings during an abortion. This reality is disturbing to hear, but it's even more disturbing the fact that these procedures are done every day. Abortions done at or after 20 weeks are done by one of three procedures: dismemberment abortion, which is a D&E, and I attached Appendix C, partial birth abortion, which is Appendix D, or 3, induction, which is saline or prostaglandin induction, which is Appendix E, a saline induction. The most common method by far is D&E. I would invite you to go to abortionprocedures.com, narrated by Apolog board member Dr. Anthony Levatino, who has performed thousands of abortions. In a D&E abortion, the mother's womb is forced widely open to allow a grasping instrument to be inserted in the womb. The living baby is pulled apart in pieces, an arm here, a leg there, maybe 10 to 15 pieces to get all the baby's body out. These babies were alive when the D&E was started. Dr. Warren Hearn, a Colorado abortionist who has performed numerous D&E procedures, wrote a textbook on abortion which states this: there is no possibility of the denial of an act of destruction by the operator of a D&E abortion. It is before one's eyes. The sensations of dismemberment flow through the forceps like an electric current. It is hard to imagine a more gruesome way to die. If veterinarians ripped apart living dogs or cats to kill them in the same way that living human unborn children are ripped apart in the D&E procedure, the outcry would be deafening. But what is worse is there is zero, zilch, nada, no medical reason to perform an abortion to separate the unborn child from the mother. There is no medical reason to perform an elective abortion after 20 weeks, the time when the fetus is capable of surviving outside of his or her mother's womb, in order to end a pregnancy. The unborn child could be separated from the mother by delivery, resulting in a live birth by C-section, or by inducing labor with the dignity inherent in the birth process for that unborn child, and safer for the mother than the D&E used in elective abortion. It is clear from testimony by abortion practitioners during the U.S. Supreme Court partial birth abortion ban that the purpose of an elective abortion is to produce a dead baby, not to separate the mother and the fetus in an emergency. Thank you.